13,000 women are diagnosed with cervical cancer every year in the United States. Now, if caught early, it is highly treatable.
In Health Watch, Shelley Botat shows us robot-assisted surgery can help women recover from surgery faster and easier.
As a mother of 3, life for Sara Zaczek is very busy.
It's fun and exciting, and my kids are just hilarious.
Sara says 6-month-old Addie would not be here if it wasn't for Dr. Peter Johnson, Director of Gynecologic Oncology at Aurora BayCare Medical Center.
The way he decided to treat the cancer enabled me to be able to get pregnant and have another child.
Sara was first diagnosed with cervical cancer in 2016 after the birth of her second child. Dr. Johnson told her,
"When you're done with childbearing, we recommend the hysterectomy because there's at least a 20% chance there's still cancer there."
I was scared.
But Sara still wanted another child. The cancer was stage 1, so Sara chose to have Dr. Johnson remove the cancer through conization.
That's where we cut away part of the cervix but leave most of it so one can go on to have a baby.
Sara needed 2, and it allowed her to have Addie, but
Following the pregnancy, again, there was an abnormal pap test.
I wanted to make sure I was healthy for my kids I have.
So Sara took Dr. Johnson's advice. He performed a hysterectomy using minimally invasive robot-assisted laparoscopic surgery using the latest cutting-edge technology, the Da Vinci Xi.
Much safer for the patient, much better visualization.
The doctor sits at a console and controls the robot with his hands and feet while using immersive 3D technology.
The robot transforms it into very smooth movements. So there's reduction of shaking. There is grading, so if I move my hand 7 inches, it will only move 1 inch with the robot, so it's very precise.
With a traditional hysterectomy, a large open incision is made. With the robot, there are only tiny incisions, so recovery is much faster.
Whereas it used to be we have to have people off 6 weeks off of work. Now they can go back to work in 2 weeks.
The robotic surgery was very easy. I had minimal pain.
Then, a couple months later, the pathology showed the cancer was deeper than they thought and invasive. So once again, Dr. Johnson performed a robot-assisted surgery.
You take additional tissue around the edges to get a good tumor-free zone.
I had surgery on a Thursday. I was back to work on a Monday.
Today, Sara is cancer-free.
It's just been a tough 2 years. I want to be here for my kids for sure. I mean, that was the biggest thing going through my mind.
The Da Vinci Xi has opened the door to new minimally invasive surgeries, including gynecology, urology, thoracic, cardiac, and general surgery. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.